Determining which type of surgery is best for each patient depends on several factors. And evaluation by a hernia specialist can really involve evaluation of all those different factors and give you a good recommendation based on all of that as to what's the best surgery for you. In addition to what type of surgical approach, however, we also have to talk about the type of anesthesia that's needed. The general principle being that less medications, less anesthesia, while keeping our patients completely comfortable and pain-free during surgery as the primary goal, but the less medications possible, the better. Because of this, when we perform many hernia surgeries, we approach this with anesthesia via the IV and with local numbing medication. This is a similar type of anesthesia as that which is given during colonoscopies, plus the local numbing medication. Most patients get by really well with that type of anesthesia, but there are certain patients who can't have that anesthesia, and those patients oftentimes have a little bit more weight in their abdomen or throughout their torso, and because of this, sometimes breathing becomes more of an issue during the surgery, and patients may need a tube placed partially into their airway to allow better exchange of air and oxygen, and this is kind of one step up from that previously discussed anesthesia. There are also certain patients who, by virtue of either their body shape or the type of surgery they're having, have to have general anesthesia. Specifically, patients who are undergoing laparoscopic surgery have to have general anesthesia, specifically meaning deep sedation, completely asleep, oftentimes some paralytic medication to allow the abdominal muscles to relax. Unfortunately, there's just no way to do laparoscopic surgery without general anesthesia. But the moral of the story is, along with tailoring the surgical approach, it's really possible to tailor the anesthesia approach as well. And we've found that patients who get less anesthesia end up requiring less opioid pain medications after surgery and have a quicker recovery. So when possible, we really try to go with surgical approaches that are amenable to less anesthesia, and also really just maximize the entire experience for patients to get them back to their real lives and over the recovery period as soon as possible.